arthritis on the knee, or what they can show outside that we can see, or like the finger I saw like something,
Yeah.
but here around, how we can help.
So the best way is always going to be getting an x-ray from your doctor. But usually the big things will be stiffness. So it'll feel like you can't move through that full range of motion. Some people will get really big joint swelling, but that's a little bit more common with rheumatoid arthritis or later stage osteoarthritis. Sometimes people will have heat there. It'll feel warm. And it can get red as well sometimes with swelling. So the big ones are always the pain and stiffness, though. Those are what you'll notice first if you have any arthritic condition.
Do you have a specific X-ray or just the normal bone?
Regular x-ray. Yep. Regular old x-rays will show it. But a little bit like I said before, if you have no pain, you might have arthritis. But if it's not causing pain, we don't worry about it too much. We always want to make sure that, I always say that arthritis is kind of like wrinkles and gray hair. Everybody gets them eventually. And how much does it bother you?
What?
For some people a lot, for some people a little. Yes.
Color.
Exactly. There's treatments.
But is it?
In fact, actually, we're going to talk about it pretty soon. So we're going to start high. We're going to work our way low. So we're going to talk about low back and tailbone arthritis. So low back pain, that's one of the most common conditions. About 90% of people will experience low back pain that causes them to miss work at one point in their life. It is a very, very common condition. And a lot of times those injuries can lead to some degenerative changes, whether that is sciatica, stenosis, arthritis, a lot of different words for low back arthritis, but that just specifies different kinds. So we associate low back pain with difficulty moving, stiffness, all of those same conditions, but it's also very closely aligned with urinary frequency and urgency, especially because all those nerves that come out and go to the bladder and to the bowels come out through that sacrum and low back area. And so if those nerves are irritated, sometimes they can give inappropriate messages. So it might be a little bit like sciatica for the bladder is what I usually say. So it might feel irritated, like you always have to go to the bathroom, and that urgency can sometimes override your pelvic floor muscles. So if your pelvic floor muscles have weakened over time because you haven't been strengthening them, they get weak just like your bicep muscles. So if those muscles get weaker and then that strong urgency happens in the bladder because it's irritated, that can cause leaking, especially that kind where it feels like you have to rush to the bathroom and you don't make it in. That can also happen with the bowels. It's just a little bit less common. Constipation as well as fecal incontinence can also be associated with this low back motion because your back needs to be able to move, and that movement moves your abdominal organs, and that movement encourages movement of the food through the digestive system. We talked a lot about this last month, so I'm reviewing a little bit. If anybody has further questions, please ask.
No, you cannot correct that urgency and incontinence with therapy. I've had therapy for that and corrected it. But I had low back pain, and then it turned into sciatica.
Absolutely, yeah. So definitely the nerves coming out of the low back can get pinched or irritated because of the arthritis. Sometimes people get bone spurs, and that can cause pinching on that sciatic nerve that goes down the leg. People will have pain going down the leg, usually way past the knee, sometimes all the way down to the foot.
Right.
And
You're going to the foot.
exactly. And a lot of times that is going to cause that limited movement, which we'll talk about in a while as well.
So if you have like a slight accident that affects your neck, you know, you move like that,
Mhm.
can that affect sciatica?
Not necessarily. There are some very, very rare cases where the whole spinal cord will be compressed, and those people will usually have symptoms in both legs and both arms.
Oh,
But if you have an accident in the neck and now you're moving differently and you're avoiding moving that low back and it's not moving through its full range of motion, it can be getting its own arthritis causing sciatica. There's not super strong correlations between the two causing each other though. But it's certainly possible to have two problems. We all know, we all know you can have more. And in rare case, that tailbone, so we talked about the tailbone attaching to the sacrum. In some rare cases, people will have a tailbone that has come forward, whether it got fractured or it was just made that way, and then it needs to move out of the way for a bowel movement. And some people may have sharp pain as that tailbone moves out of the way with the bowel movement, and that can contribute to constipation as well. And sometimes people will consciously avoid going to the bathroom, so that can cause some behavioral changes as well because they don't want to be in pain. And so things like stool softeners and things like that we talked about last time can be very helpful if you have any of that tailbone arthritis. But a lot of times sitting posture can help a lot to move that tailbone out of the way. And so pelvic floor PT helps a lot with that. And then there's prolapse, which can be more common with fibroids. Fibroids
and they show the prolapse where you can actually see it falling down. But can you have prolapse and it's falling down and you don't even notice it?
So a lot of times those are different grades of
Okay.
prolapse.
All
So the first two, the uterus does not come out of the body at all. But that can be associated with low back pain that is worse when you're standing for a long period of time, better if you're laying down. And that will also sometimes be associated with difficulty going to the bathroom. Maybe you need to push things out of the way. Some people will occasionally notice a bulge at the entrance of the vagina. That's kind of our grade. And then our last grade is the uterus all the way out. And a lot of times people will need surgery to correct that one. It's just very hard to get the pelvic floor muscle strong enough to support that.
What did you say about fibroids? Did you say something about fibroids?
I did. So fibroids are growths on the outside of the uterus. They're mostly associated with heavy fecal periods, but they can also be small associated with risk of prolapse, especially after menopause. So after menopause, you're no longer getting your period, but those growths oftentimes will shrink, sometimes they don't. But fibroids are benign. They're nothing to be worried about as long as you're not having bleeding issues. So a lot of times the reason we get concerned about fibroids is because people are getting anemic and weak and dizzy during their cycle. Yeah, and so you can also have prolapse of the women anus. So that will affect both genders equally, and it's associated with constipation. And that'll feel oftentimes like a ping pong ball between your butt cheeks when you stand up after a bowel movement, because that constipation has pushed it out. And it's kind of like we were talking about how the uterus can be out and you need to push it back in. The same thing. All right, my favorite hip arthritis information is actually one of the first things I researched as a pelvic floor PT, because I had a patient who had a hip replacement, and she came to me and asked me about her increased incontinence, and I was like, I don't know. And so when I started doing research on this, I became so fascinated by the pelvic floor that I actually became a pelvic floor PT. So we're going to talk a little bit about these muscles. So this is the glute, the big gluteus maximus as we know it. that has been removed, and we're looking deeper at the joint at these small hip external rotators. So there's this one, which helps your pelvis stay upright. There's these ones, which make your hip come out. And these ones attach in. These muscles attach onto the same ligament as the pelvic floor muscles. So if the hip arthritis is causing joint pain, all of these muscles are inhibited or they're weaker. They don't get as much activity. If they don't get as much activity, they get weaker. And so if these muscles are getting weaker, they're not providing tension to the pelvic floor muscle the same way. And so it's more likely that people with hip arthritis are going to have pelvic floor dysfunction, whether that is urinary urgency, which affects both sexes equally. It could be urinary incontinence, which is more common in women, but still possible in men. And it could also be that prolapse, which again is more common in women, but also possible for male patients. And so if you have a hip replacement, because replace that. That's the old school version. It's the more common version that you'll see in folks who had hip replacements. But those are people who had those movement precautions. You're not allowed to bring the knee up to your chest. You're not allowed to cross the knee, and you're not allowed to let your toes come in, because we were worried about the area where we cut through these muscles that stabilize the hip. And because we cut through these muscles that were already weak from the pain before, so now we cut through these muscles that were already weak, and now they're weaker because we cut through them. And so we actually found that posterior hip replacements, the ones that go in the back of the hip, aggravated incontinence in a lot of patients. And so we weren't asking about it, and people didn't want to tell us about it because people were obviously embarrassed that their incontinence got worse, but my patient told me. And that's when I found out about this posterior approach, the back approach to the hip replacement can cause incontinence to get a little bit worse. And that's why it's so important to go to PT after a hip replacement. So a lot of times hip replacement can make urinary incontinence better in the long run, but that posterior approach can make it worse in the short term. And that's why a lot of times surgeons are moving towards this anterior approach if that person is appropriate for this newer version. And that's going to go in the front of the hip. And that means that person can bend the knee, they can bring it across, they can let it rotate in, which makes dressing a lot easier. We're going to talk a lot about that. But it also makes getting on and off the toilet. It makes sitting on the toilet with your knees toward knees higher than your hips so that a bowel movement is easier. It makes it so that going to the bathroom is a lot easier because we don't need to worry about those back hip muscles. And because those back hip muscles aren't getting cut, they stay stronger and they're more likely to lend their tension to the pelvic floor muscles and make the pelvic floor muscles stronger by association, right? I know this is really cool. And I went through a lot of things quickly. So does anybody have questions on the hip joint? Okay.
How you do it, make it stronger, because it can be weak or something.
Yeah,
Stronger.
absolutely. So a lot of times if you go to a physical therapist for hip pain or even low back pain sometimes, or knee pain, a lot of times because the hip connects the low back and the knee, and it can cause its own pain. A lot of times we look at the hip and how it's associated. So we will have you like lie on your side and maybe rotate your hip. We call this external rotation. You might have called them clamshells if you went to physical therapy. A lot of times as you get stronger, we'll put a band around your ankles and have you step out. That's another way we make those muscles stronger. Have people do bridges.
Which muscles are you making stronger doing that?
The glute muscles and the external rotator muscles.
Oh,
So as we make these muscles stronger, you'll lay on your side at first. Sometimes you'll lay on your back and you'll lift your hips up. That's a bridge.
okay.
Sometimes we'll have people standing up and getting in and out of a chair. That's a more advanced exercise. And also that one with the stretchy band around the ankles and stepping out. That's another more advanced exercise that will give people to strengthen those hips. But I'm going to bring it back to the knee for a second. So a lot of times people with knee arthritis will have it on one side or the other side. And a lot of time that's because their hip wasn't working really well. So if my hip is really weak in those external rotators, I might have my toes come in a little bit because I can't bring them out very well. And so if they're in a lot, I'm putting uneven stress on the inside of the knee or the outside of the knee. And that can cause the knee to hurt when really the hip is weak. So that's where that chain comes back again. And we start to see, exactly. So we start to see you need to treat the whole body. And that's where physical therapists shine a lot, because you may come in with knee pain and we're going to take a look at your ankle. We're going to take a look at your hip. If we find stuff in the hip, then we're going to move into the low back and the abdominal muscles, because we know that all of those work together. And if you have a problem at the knee, it's likely not a problem at the knee. It's likely a problem with the whole chain. And so we need to find all those issues in the chain and help them.
And I just have 2 questions.
Perfect.
I wanted to strengthen my thigh muscles, to be able to look like heavy camera equipment, right? And so, and I was told if I do the squats, like you said, that would strengthen my thigh muscles. And then also, how do I know if I'm not a candidate for pelvic floor exercises, like you were saying, the program?
Absolutely. So
I do have fibroids.
I was going to say, so there are 5 functions of the pelvic floor. And I'm giving you all like a quick heads up on my presentation this weekend. So everybody should come out on the 20th. I'll be giving a lecture about this at 3. But the 5 functions are sphincter, so that closing and opening of the urinary and bowels. Strength, support, so how strong are they supporting those organs? Stability, moving back and forth through your hips as you're walking, reaching, all of those core functions the pelvic floor is involved with. It's also involved with sexual function and circulation. So I'm going to talk about all 5 of those a lot more, but if you have problems with any of those, you should talk to a pelvic floor PT. So if you're experiencing heaviness, something falling out, urinary urgency, incontinence, constipation, heck yeah. And I always say, I am a physical therapist. I am not your physical therapist. So I'm only giving general advice here. But absolutely, if you have any of those issues, you can talk to a pelvic floor PT and they will come up with a holistic approach to deal with pelvic floor issues. And if you have any other issues, whether it's low back pain, hip pain, knee pain, hand pain, they will figure out what you need to do to address those as well.
Now, to see you, do they need a referral from their primary care physician if it's a managed care HMO or PPO?
If it's an HMO, a lot of those will require a referral, so you'll need to go to your PCP. Medicare does also usually require a referral. They're just a little bit more persnickety. If you have private health insurance or you're not on Medicare, you can see a physical therapist with direct access, which means you just come in and you can get evaluated, and then they will come up with a plan of care and communicate with your doctor as needed to get a referral. But you don't necessarily need to start care, which is a very good thing because it means that people get help faster than if you're going to your PCP, going to a specialist, waiting months for that appointment. So it's good because it can help you get started. And then if you do need further intervention from a specialist, you can have that appointment there.
And what is that appointment called?
An evaluation. So you would schedule a evaluation with a pelvic floor PT, or if you just have knee pain or you just have hip pain, you could also talk to physical for a regular bread and butter physical therapist.
How we gonna get the right one? Because sometimes we talk with somebody and then you go, oh, that's I own nothing.
Exactly. So if you have joint pain and some of those floor dysfunction I was talking about, I would recommend talking directly to a pelvic floor PT, just because they're going to be able to treat both things. If you just have joint pain, you can go directly to your local outpatient physical therapist. If you have neurological issues, like if you've had a stroke or if you have Parkinson's, like we talked about last month, it can be helpful to also talk to a neurological physical therapist. That's a different specialty, and they will have more knowledge on how to treat the neurological deficits. And a lot of times, all of our specialties work together. There are also geriatric physical specialty, specifically in people who are seniors. So there are a lot of specialties, but a lot of times if you go to a outpatient physical therapist and they think that you need a further specialty, they will even refer you to a specialist that they know in the physical therapy profession. So I have a lot of physical therapist friends that if they're working with as well as
It was another, or.
yeah,
I have another couple and it not work, but they still keep doing the same,
yeah.
nothing improved.
I was gonna say, physical therapy does also take time a lot of times. So it takes about 6 to 8 weeks before we start to see those muscles get stronger that I was talking about. And that's all muscles, whether it's pelvic floor, hip muscles, low back muscles, core muscles. So a lot of times it takes anywhere from 2 to 3 months before people will really start to see those effects. And people are impatient.
No, the co-payment is too expensive.
That's another
No,
huge barrier.
something.
That's a huge barrier. Absolutely. And unfortunately, we can't do a lot on the ground to help out with that. Usually your best bet is talking to your insurance company and seeing if they have any waivers.
Yeah, I'd like to know that we can talk with somebody that they can work, so it's like, not like that, and I go to my insurance, they track me like 45 co-payment, I'm mad.
Yeah.
8 times.
Yeah, I was gonna say, a lot of times finances are unfortunately the chief reason that physical therapy is difficult. But some surgeries are also expensive, doctor's appointments are expensive, it's a systemic issue.
So I didn't get a, pelvic floor.
How do you find a pelvic floor PT? So there are directories. So the American Physical Therapy Association, the APTA, has a big database of all the pelvic floor PTs, and you can put in your address and they will find the closest one to you. And then you can call them and ask if they take your insurance, if they have an appointments coming up, if you can schedule with them. If you have a doctor who is giving you a referral, so for example, if you've already talked to a doctor about this urinary issue and they've recommended pelvic floor PT, a lot of times they will give you a name of somebody that they trust. So a lot of times, especially OBGYNs and urogynecologists will even have pelvic floor PTs in their office. So a lot of times that can kind of streamline things if you're able to just go order. If you've already got a referral and they've recommended someone by name. A lot of times that can help because then you have a personal recommendation. So you know that at least this doctor trusts that physical therapist who can see results. So, I know that's good. Okay, so here are some other dysfunctions associated with arthritis. So the big one is an increased risk of falls. So if you're not moving around well, if it hurts. So for example, if my knee is hurt and I step wrong and I have sharp pain, it's not uncommon for those muscles around the knee to turn off to try to protect that joint, and I fall. And so hip arthritis, knee arthritis, low back arthritis, sciatica are all associated with an increased risk of falls all on their own. And then there's that urinary urgency and frequency and stress incontinence that can cause people to be rushing to the bathroom. So now if you have pain and you're rushing, maybe you use a cane or a walker, all of those can make it hard to get to the bathroom in time. And now you're rushing and you're worried, and that doesn't make the pelvic floor muscles work better. So it can kind of compound on itself. There's the difficulty dressing and undressing. And we talked about the knee arthritis, hip arthritis, low back arthritis, after a hip replacement, hand arthritis, getting buttons and zippers to work. All of those can make it more difficult to get on and off the toilet. And if you're rushing, all those seconds count. And then there's also people in pain tend to not be as physically active as they should. And so that can cause other medical conditions, like making you more likely to have heart conditions or diabetes or weight gain. People will experience depression and anxiety around that, where they feel less like themselves. They can feel incapable of taking care of themselves or ashamed that they have pelvic floor issues, but pelvic floor issues are very common and it's a very treatable condition a lot of times. So it's important to talk to people and not feel isolated by them, which is one of the reasons I make an effort to come out and talk to people all the time. You can also have skin irritation from incontinence pads. So if you have a lot of incontinence and that urine is soaking into the skin, it can cause irritation or even sometimes open wounds, which can be very dangerous if they get infected. So we want to make sure that you are changing pads often if you use them, and preferably not needing to use them because you're not leaking. That's always our big goal. And sexual dysfunction. So that can be erectile dysfunction, pain with sex, and difficulty maneuvering into positions for sexual activity. If those joints of the low back, hip, knee, or hands are all being affected.
Okay, now this sexual
This is
dysfunction,
always the one that gets questioned.
yeah, I can't believe that that has something to do with arthritis. And then the pain with sex. You know, your gynecologists tell you about how you're supposed to use some kind of little stuff to give you the pain with sex. But you're saying that pelvic floor can help with that?
Absolutely.
Wow.
So if you think about, if you zoom back to when I was talking about those hip muscles, so let's use hip arthritis or low back arthritis, because those tend to be the most commonly affecting the pelvic floor. So I talked about how if those joints are painful, the muscles around there can be painful. They can get tight, they can get sore, they can get spasmed and crampy. And so that can affect the muscles around the hip and around the low back. Those muscles also attach into the pelvic floor. And the pelvic floor muscles, by association, can also become stiff and crampy. And so especially if you are the receptive partner in your sexual activity, if those muscles are tight and crampy, they're not going to be able to relax and open up. And that can cause friction, pain, sometimes even bleeding. And a lot of times your OB-GYN will recommend lubricant or vaginal estrogen and some of these creams that can help with the skin irritation. But if the skin is being irritated because the friction is too much, because the muscles are too tight, you might still have pain even after using those creams. And so it's important to keep using those creams because they can have separate impacts on the skin down there. But if you can also get rid of the pelvic floor tension, and if you can also make it so that the hips move better so that you can get into better receptive positions, then you can have better sex and better urinary function and better joint function. I'm very passionate about sexual function as well.
That's another lecture.
That's a whole other lecture. That is a whole other lecture. Trust me, I will gladly come back.
Yeah, yeah.
We can talk about pillows, we can talk about devices, we can talk about everything.
So how do you arthritis?
Arthritis of the hands, I usually refer them out to my hand specialist friends. So there are a lot of, especially OTs are really good specialists of hands, and they will help you get rid of that pain using some heat, some massage. They're going to strengthen the muscles around the joints and make sure the joints move as well. So joint strength and joint movement are our big treatments for arthritis. And as I know, it's the last thing you want to do. If you have arthritis, the last thing you want to do is move them a lot. But moving them a lot is the only way we treat it. And so they'll help that with the hands specifically. And they can also help you with assistive devices like braces that help to reduce stress, and sometimes putting chunkier handles on things so that your hands don't need to clench as hard. So they can help you with button removers, zipper pulls, braces, assistive devices, chunkier handles for things like forks, knives, other things.
Could arthritis be hereditary?
Arthritis does have a lot of hereditary factors. So if you have a direct relative, a mom, dad, sister, brother who had a lot of arthritis, it's more likely that you'll have it, similar to diabetes, but it's not necessarily true that they'll get it.
My dad had arthritis in his fingers really bad, and he would get these nodules on his knuckles.
Yeah, that big swelling.
And I noticed that I got one little nodule on my thumb. But I don't, it doesn't seem to bother me.
Exactly.
But it's there, and I know it's there.
So likely you're predisposed to have it, and you might have some of those degenerative changes we talked about. But like I talked about way earlier when we were talking about x-rays, you can have those degenerative changes and not have pain. So if you maintain that joint range of motion and its strength, so doing things like squeezing a stress ball, opening up against a rubber band, scrunching some towels. These are all like little exercises occupational therapists have taught me. Not texting. No, texting is not a good one.
it, people using their phone.
And then they get something specifically called decurvain tendinitis. So they'll also get, tendinitis will cause tendon issues. Yeah, so tendon issues will look different than those. But yeah, taking care of your hands is important. Hands are how we interact with the universe. I had a friend at my old clinic who was a hand therapist, and his wife used to joke that he just held hands and comforted everyone all day. She's like, "You're a professional hand holder." And I thought it was the cutest thing. They do have foot therapists. They do often do a lot of good work.
There's a lot of nice therapies.
I was gonna say, I always send people to the reflexology therapist. So there's reflexologists who specialize in foot
Yeah.
things. Whoa, and they will give you good foot massages. There was a nice place over in Lincoln Park I always refer people to that had a buy 10 get 1 free discount card.
Where's that?
It was in Lincoln Park. It was called like Happy Feet. I'm not sure if they're still around. This is many years ago now. So this is my putting it all together. You might remember this from the constipation lecture. But similarly, we find that if you're having that difficulty dressing and undressing, you're getting slower with buttoning and unbuttoning, bending forward, sitting down in a chair, getting up out of the chair, and you combine that with urinary incontinence. You might be rushing and trying to get your pants off at the same time, and you might trip and fall. And if you trip and fall because of balance and coordination issues, you're using an assistive device, you have joint pain, you might injure yourself. And now you might have decreased mobility. So now you're moving less. So that arthritis may get worse. You may have more difficulty needing help more. This can often be one of the reasons people end up in an assisted living situation or living with family when they previously would have wanted to live independently. So this decreased mobility can have a lot of quality of life implications. There's also that reduced physical activity and that reduced exercise that we talked about, leading to other medical conditions as well as worsening the joint pain. And sometimes that pain medication can make people dizzy. It can make people more constipated, and it can also interfere with other medications, causing more dizziness, more risk of falls, more sleepiness, and less physical activity. So a lot of times these things can all interact in a very complex way. And if we're able to interrupt by, for example, making it easier to bend forward and get undressed, easier because you're not rushing to the bathroom, easier because your balance is better, easier because you're more mobile and you're less likely to have other health conditions. All of these things can work in the opposite direction and make you better in a lot of ways. So that's where physical therapy comes in. So what is pelvic floor PT? So I'm going to talk a little bit more generally about how PT treats osteoarthritis. And I've been talking about it pretty much this whole time, but what we focus a lot on is range of motion. So I have my nice book on bikes. Bikes are a really common one that we'll use for hips, low back, and knees because it gets you moving and grooving. And that phrase you'll often hear is motion is lotion. So the more you move that joint, the more it gets lubricated, get some WD-40 on those knees, and then we're feeling better, we're moving better, and that causes less pain. And if you have less pain, you're more likely to move, and that more movement puts more lotion on the joints. We'll also talk about muscle strength. So a lot of times if those thigh muscles like we were talking about are too weak, you have to put a lot of stress through the bones, and you might be moving in different ways that are putting stress through the knees or through the low back. And so we can teach how to move your body so that you don't need to use as much strength, or if we teach you how to get stronger, that you don't need to worry about that strength. That can help a lot. We'll also help with alignment. So that's kind of like I was talking about. If you have a lot of hip knee pain, you might be putting your toe in, and that alignment is causing more issues on one side of the joint or the other side of the joint. And so getting you stronger, improving the alignment can help to take stress off one side of the joint. We'll also all types of for low back issues. We'll also talk about pain, balance, and coordination, and pain management that is non-pharmaceutical. So things like hot packs, cold packs, massage, movement. Movement is one of our greatest anti-inflammatories. So that helps a lot to reduce the joint pain. So this is just my slide saying how physical therapy overall is a holistic profession. We're going to look at the joint that is painful, the joint below, the joint above it. We're going to take a look at the whole kinetic chain, as we call it. So we're going to take a look at musculoskeletal strength, posture, coordination. As a pelvic floor PT, I'm going to work a lot with exercises, because a lot of times that helps a lot with that stability and support aspect of the pelvic floor. So there's a lot going on. And here is just a little bit more about what physical therapists treat. So we treat muscles, joints, and nerves. We're talking a lot about joints because we're talking about arthritis, but there are also the muscles and nerves, like we talked about sciatica, it's a nerve problem, and we talked about leg weakness, that's a muscle issue. So we'll look at all the muscles related to the pelvic floor. We'll also look at the low back muscles. We're going to look at joint movement. We're going to low back, hip, sometimes that rib and upper back. I'll take a look at the knee and ankle, having issues in that area. But we'll also take a look at the tailbone. How well is that tailbone moving? Does it do association? And then there's bigger overall posture and mobility. People will not talk about the tailbone beyond those little donut pillows, and if that doesn't work, if that's not your issue, people who are general practitioners might not know about the tailbone and how it can affect these things. But I'm a specialist, and so I think about the tailbone all the time. So exactly.
They, because this is, I never know that they're concerned about the bowel moving or
Mhm.
something.
Mhm.
So actually, when people they get to the toilet, we're supposed to unapproach it. So it's really bowels coming.
Yeah, and so that's one of the things. Harder to have a balance. And so then we need a second assistive device. We need a squatty potty or a stool to bring those knees higher than the hips again to make bowel movement easier. That's going to change your posture so that you're kind of forward a little bit. That tailbone can move out of the way. It's easier to have a bowel movement without straining hard, because that straining hard can make prolapse worse. So everything is interacting.
And so where do your knees need to be so you can use the bathroom, right?
They need to be higher than your hip.
Okay.
So that makes puborectalis, one of the pelvic floor muscles, relax and lengthen. And that makes it so that the rectum, rather than having a right angle turn that you need to push around, becomes straighter. So you don't have to.
Oh, I never know that they have to be.
Why is it sometimes you're up, because you know you have to go to the bathroom. Other times it's like, boom. You have to eat out.
Yeah. So
And then what you ate.
there are a ton of reasons. What you ate is one of them. So if you had a lot of food that causes distress, you might have a lot of grumbling, mumbling. You may have bladder pain. Sometimes people will have very concentrated urine. That's one of them. Sometimes people will have diarrhea. That's a lot of times another strong urge to rush. Sometimes it's behavioral. Like every time I go in the door, I unlock the door, I take my shoes off, I go to the bathroom. I unlock the door, I take my shoes off, I go to the bathroom. And eventually my bladder learns that and it goes, I put the key in the door. I
Wow, it's deep.
Exactly. We call that latchkey incontinence.
Sometimes you don't train it, it just does that.
Exactly. And sometimes it can be anxiety related. Sometimes people go just in case a lot. So
You
I'll-
laugh, you
mhm.
sneeze, you cough.
Those ones we're getting into stress incontinence. A little bit of a different story. I'll finish off my urge thought and then we'll get into stress. But urgency a lot of times is because your bowel and bladder have a lot of reflexes. So they feel a stretch, they sense that they are filling with liquid, stool, or gas. And they send that signal to the brain, and the brain says, okay, you tell the pelvic floor that. And so the bladder will squeeze, the rectum will squeeze, and they will essentially ask the pelvic floor can we go to the bathroom? And so you might remember you were much stronger to the way they used to be when you were younger. So that could be because of child growth causing conditions, that could be because of less that could be because of irritation of the bladder, making the bladder squeeze stronger. So there's a lot of different factors that can make that conversation a little bit more one way, a little bit more bladder leading the conversation. And so that can happen where that urgency is stronger than the pelvic floor, and that's when accidents happen. But if you straighten the pelvic floor, a lot of times that can help reorganize that conversation. So a lot of times I'll train people to, if they're feeling that urge out of nowhere, squeeze, relax, squeeze, relax, squeeze, relax, stop. And closure of the sphincter tells the organ, we can't go to the bathroom right now. We're not ready.
Okay, so stop, squeeze, relax. So how long do you have to squeeze again? When do you count to?
Up to 20 times. So you're not going to want to do a squeeze and hold. You're going to want to do a repeated squeeze.
20 times.
Yep. Squeeze hard, squeeze fast, 20 times. I call them quick flicks. It's kind of like one, two, three, four.
They used to call it like, just cool.
Eagles. Yeah.
Yeah.
That can be very effective very quickly if it's just an urgency issue. But if you're having other issues, that might not always be effective. So if that doesn't work for you, go talk to a doctor and find out what specifically is going on.
You know what, that's interesting, because some people have jobs where they cannot just get up and go to the bathroom,
Mm-hmm.
you know.
And I will occasionally see people who have the opposite issue, where they get to the bathroom and then they can't make those muscles relax because they've been holding it so long. So my teachers and my nurses are most often the folks that I'm talking to about being able to relax and open at the end of the day.
Is it best that if you get the urge to take care of that urge right away rather than delay it and watch?
To go on a car trip, all of those things, totally fine. Go to the bathroom if you have that small urge and you're like, oh, I'm gonna be in the car for over an hour. That'll be uncomfortable for me. That's when you can make a choice to go to the bathroom. If you're, for example, watching a movie and you go right before that movie starts, you should be able to hold your bladder for 2 to 4 hours. So you should be able to comfortably make it through that movie. Hypothetically. Now, again, there's a ton of reasons why that conversation can become one-sided and the bladder can be leading the dance. But if all things are working well, you should be able to sit through that movie, and you can always make the choice to stand up and go. For example, if you're watching on Netflix, you can pause it, you can go to the bathroom in your own house. But if you don't want to miss something, if you're in a lecture, a meeting, a nice meal with friends, and you don't want to stand up and walk over, you should also have the ability to make that choice. Now, there are also different levels of urgency. So if that urge is a, hey, I could go to the bathroom, that's when you have a lot of choice. If that urge is, I'm doing the wee-wee dance, I don't know if I'll ever make it, you may want to do that urge reduction and then go to the bathroom at the nearest possible opportunity. But I often say, if you find that you are going to the bathroom before you leave the house, that you do not have a lot of choice, and you want to talk to a doctor, a pelvic PT, about how you can improve your choice. Any questions?
Good one. Everything is
Awesome.
Yeah, happy with that.
Aren't you glad to say?
Exactly. And I finished up as fast as I could. We had a lot of good questions. If you have any questions that you wouldn't feel comfortable asking in front of the whole group, my email is up at the front. It's just Ariel@groundfloorpt.com. My name's spelled Ariel. And this will also hypothetically be recorded, but if you ask Judy, she also has my email as well.
we get a copy of this presentation?
Absolutely.
Yes, I meant to make copies, I'm sorry. Thank you, Sam. Thank you, Ariel.
Thank you, Ariel.
Thank
Yeah.
you. Lovely to see everyone. I'm happy to do all. That's what I'm talking about.
Yeah, and I definitely want to invite you back because you brought up so many different topics.
I was gonna say, we didn't even get to talk about all the sexual dysfunction.
No. Ariel, just reminded, we'll be at the Uptown Wellness
Mhm.
event this coming Saturday, show
What
at
time?
3 p.m.
My lecture is at 3, but the fair itself is gonna be from 11 to 4. And so I will have a table there. You can come ask me questions. You can come say hi. It's gonna be at the old Wilson station at Wilson and Broadway.
The people right in front of you.
That's the new Wilson.
It's gonna be across the street
Francis.
in the triangle.
Oh, okay.
Oh, that new building.
Yeah.